Awesome. Oh, we are live. Okay, while I wait for people to join, let me quickly put the topic into about pregnancy. Hey, Mayo. Good to have you here. How are you? Hi, Divine. Welcome. Hi, Olatayo. Welcome. I'm just trying to fill in the topic. Just a minute, guys. How is everyone doing? Please let me know that you can hear me though. Hey, Dorothy. Good to see you, sis. Let me see. Trying to post the topic. It's not really complete, but I think we can work with that. Dorothy, so good to have you on this live. Wow, I need to ring like a bell for you. First time and okay, not really the first time, but I mean, hey husband, welcome. It's good to see you here. Okay, thank you. I just wanted to be sure that you can hear me. Hi everyone. Because after last month's live, someone was saying that my volume was quite low. So I was a bit like, I thought I was doing mic check. Hi, Trembola. Great to have you here. How are you doing? Welcome, everyone. Happy Sunday. I know, you're not the first time. But I mean, I'm excited that you are here. So just take it the way it is. How you guys doing? How's your Sunday? Oh no, not how is your Sunday going? Just a second ago I was really cold. Now I'm hot. What is this? Is this magic? Hey Jude, great to see you. How are you, my fam? How's everyone doing? Welcome to another beautiful episode of I was about to say Wisdom Tips with Ife Talks. Oh my god, welcome to another lovely episode of Ife Talks. Come on, Ife, you can do this. Get your mojo. Hi guys, how is it going? Welcome. Excited to have you guys here. Hey Fabian, how are you? Welcome. It's so good to have you guys. I'm super excited, super pumped about this month's topic. And just like last month, I had a lot of people send me questions, for the show, and I couldn't even exhaust the questions because we had done like an hour, 30 minutes, if not even more, and the questions just kept pouring out. And then just like that again for this particular one, right? Immediately I put out the flyer. My god, who just said me? It's true, I need to know this, that. I said, all right, yo, let's see how far we can go, because I have a lot of questions, like a truckload of questions, and I'm really excited about the person that is going to be helping us to tackle these questions, right? Hey Dr. Oluwayemisi, good to have you here. How are you? Right, so I'm excited about who will be tackling it. Wait, let me just be laughing, right? Because if you follow the Noisy Pediatrician, right, you would see how he shares nuggets on newborns, on Catherine, Nobi, even people that are experienced mothers, people that are elders in this motherhood journey. They are here. I celebrate you all, right? Okay, just so that we don't become the kind of moms some of our moms are to us in this thing, because some of the questions I got, right, from people that sent me questions, because I have my own questions, right, but I'm excited that people also sent me questions, like, you just saw that people are going through a lot in this newborn baby journey, and they just need a lot of clarity. And when I went through the questions, there are things that I can relate to, right? Because as I was going through the questions, I was just smiling at, okay, what people were sending to me, like, okay, I get you all, I totally feel you all, I see where this is coming from, right? Anybody who has, even if you haven't even had your child, but maybe your sister has had a child or something, you would be able to relate to you know, some of the things that is happening here. Like, I mean, before I even got married, when I was living with my sister, when she had her baby and all that, her first son, you know, I was literally the nanny, right? And so even if I wasn't married, right, even if I've not gone through this, I mean, there's some things that you would have seen that happened, right? Maybe the mother-in-law did this or your mom did that, and you can relate. So that's why I'm really excited about today's topic, right? And the noisy patron is going to be here with us any moment. Hi, Taiwo. Welcome. So hi, Joby. You said fatherhood. Okay, drop your questions now. We're here for you. We got you. We got you. So we're here for you. No wahala. No wahala. All right. I'm seeing messages from my guests. I'm just trying to okay, that's fine, not a problem. All right. So to everyone who sent me questions, thank you. To those who still send, thank you. But I mean, today my guest has already said that he has a very, very tight, I'm trying to say a very slim time, so he's not going to be here forever, right? So we'll just do this as fast as possible. Chidima, welcome. Mr. Shoname, so good to have you here. The Don himself, Odogu. That's your nickname now. After all the accolades they gave me yesterday. God, if I was not married, I'd be saying God when. All right. Well done. So thank you all. Thank you for joining. I hope we're good. How have we been? How's your week been? How's June been so far? How is the subsea removal going? I mean, is it pinching you or is not? I mean, some people are like, I mean, it's all good. It's we move, right? We move. Well, some people are like, hey God, petrol 500 naira, because the reality is that a lot of you filling stations, that's how they're saying it's 500 naira. They are not doing that 488 or 487 that the government is doing. So anywho, yeah, so just a second, guys. Right, are we good? We're good? Okay, awesome. Yeah, thought there was a little bit of a network drama, but we're good now. You can hear me, you can see me. Are we great? I felt like the thing just ceased for a second. Hey boy, great to have you here. Welcome. Can you see me? Can you hear me? Can you? Okay, great. Thank you. I just wanted to be sure because I noticed a little bit of so we're just waiting for our guest. He dropped me a message a second ago, so now I'm just waiting for him to join so that we can just jump right at it, right? I don't want to let me see. Hi, legit Bo. Great to have you here. Okay, so I think I have it. Awesome. So we're just going to start. Are you all ready?
Hello, Ife.
Good afternoon, sir. Welcome.
Good afternoon.
Great to
have
you here. We're
it's good to be
that you are
here.
The whole world has been waiting for you. So we're super pumped. We're super pumped that you're here. Thank you so much for doing this. Thank you. Let me tell you guys a very quick one. So I mean, I don't know Dr. Rena, right? But someone knows him, and then someone I now asked her, please, oh, I see that people comment a lot on each other's page, that I'm trying to bring him to my page to have a conversation on this topic that we're doing here today. That can you connect me and all that? And she was like, oh, sure, why not? And then she gave me his number, and I called him. The day I called him, so that you can know that there are people that are very humble in this life. The same day I called him, like, there was no issue, there was no I mean, if you know Dr. Rena, you know he's a very popular, like, I'm sure that he's the most sought after pediatrician in the world, right? But like, he just said, oh, that's fine, no problem, that's good. But as in, it was just effortless. Even me, I was shocked. I was not even giving it. They said, no, any date is fine. I'm like, sir, like, just like that. So please help me say thank you to Dr. Rena. Thank you so much, sir. I'm genuinely grateful that you know that you are here today and you are doing this with us. And I mean, we're excited to talk with many nuggets that you'll be sharing with us. So I appreciate it. And how did I know Dr. Rena? So when I was pregnant with our first baby, I had a colleague who was pregnant too. So she was listening to his stuff on IG. She's like, if do you know this man? I'm like, I don't even know what you're listening to. You need to follow him more now that you're pregnant. I mean, he's always sharing things about children, newborn, blah, blah, blah. So you will need to. And I'm like, okay, yeah, send it to me. And because that the thing she said to me that it made sense to me. I really enjoyed it. So maybe I started following him, and I've been following him for like over 4 years now, right? So, and for me to say that he needs to come here, you will know. And he shares all this important information with a lot of humor, right? It doesn't make it so difficult for you to get the message, right? Let me just quickly read his profile. Dr. Adede Rena is a consultant, a pediatrician, digital health communication expert, health blogger, and lifestyle influencer. He has 7 years of experience in caring for children in both preventive and therapeutic settings. He infuses a healthy dose of comic relief, wit, and charm in presenting free public health education and instruction in global practices in childcare by making learning for parents fun and exciting with his online blog on Instagram, The Noisy Naija Pediatrician. So if you're following me and you're not following him, first off, just follow him first. Just follow him first, because I'm not even joking. Things he shares so good. He volunteers for non-governmental organizations like Ask the Pediatrician and Luvia Health to promote health and wellness to undeserved communities in Nigeria. He has won several awards for his volunteer work. His great passion and career focus is working greatly towards ensuring that no Nigerian child dies from preventable causes. He hopes to achieve this through his medical practice as well as public enlightenment via his various social media and offline platforms. So please, one more time, help me celebrate and welcome Dr. Rena to the Ife Talk Show. Like, what a
Yay!
you're
Thank you.
good. You're doing well. You are doing amazing. All right, so let's just jump right at it. I know you don't have so much time here, so we'll just go. The very first question I got from someone, even if I go to my own questions, right? The person talked about being pregnant, and new moms who just put to bed. Maybe you have a child who is still maybe like 4 or 5 months, and then automatically you are pregnant again, which happens fortunately or unfortunately, mistake or whatever. Right? Is it safe to breastfeed a baby when you are currently pregnant for another baby?
It's something that can happen. I thank you very much for having me, Ife. I mean, I've seen a lot of my people here, and of course, a lot of the people are here as well. I've even seen some of my secondary school classmates, Sabido, and they are here, so which is really exciting. So thank you once again for having me, and thank you everyone for joining. It can happen that a woman who is pregnant or who is breastfeeding gets pregnant. Technically, what they say is that if you are exclusively breastfeeding the way breastfeeding should be done exclusively, then you really should not get pregnant. And that's what we call lactational amenorrhea. So if you are exclusively breastfeeding the way breastfeeding should be done exclusively, then you should not get pregnant as a form of contraception. But we know that there's no form of contraception that is 100%. The shop can still open accidentally. So if that happens, there is no danger. There is nothing that says that a woman who is presently pregnant cannot breastfeed. There is no contraindication. There's nothing that says that a woman who gets pregnant cannot breastfeed. However, each woman needs to take these things into consideration. So for instance, if a woman is breastfeeding and she gets pregnant and she has other underlying conditions like hypertension or diabetes, or she has some kind of risk factors that might make a pregnancy difficult. So for instance, if she has lost pregnancies in the past, or if she's been trying for a really long time before getting pregnant again, that's not the mother that would advise that she should be doing breastfeeding and pregnancy at the same time. No. So you either carry the pregnancy through, or you suspend the breastfeeding. But in an otherwise healthy mother who feels psychologically capable of doing it, she can actually breastfeed and be pregnant at the same time. So because we need to consider the mother's mental state. If she feels capable, to do it, yes, she can actually do it all the way.
Wow, amazing. Thank you so much for that answer. I know that a lot of people will be saying that exclusive breastfeeding and as a form of family planning, people always raise their eyebrows like, I beg go. I mean, because just like you said, nothing is 100%.
Nothing.
Because people have done it, and unfortunately, it did not work out for them.
It didn't work,
right? So I can't try it. I'm sorry, I wouldn't. Just a teaser on that. Like when I put to bed, my husband said to him that I'm babe. I said, no, babe, nothing, bro. We're not doing that. Hey, we skip that. Don't do it. Well, okay, thank you for that, sir. So let me go to giving birth now. A woman has put to bed. I have so many questions here. Let's see how much of them we can take.
Yeah.
Let's put to bed. Now, this thing that happens when they get back home from the hospital and the mothers now say, okay, it's time to give the baby the first bath. Like the first bath is not happening in the hospital. Anyway, and then they now use this native sponge and palm oil to bathe the baby. You know, like when they were doing it for my son, when first I was really afraid because, you know, I feel like that sponge is really hard for a newborn skin. And then palm oil, like, why are we palm oiling? So what is this? What is this? I know some people say that, oh, it's not right. Some people say it's right. You should not put palm. Why are you putting palm oil on it? Why are you using hard sponge? You soft sponge? What exactly you have to say about this act that almost always happens?
Yes, I mean, it's something that is really traditional for a lot of societies here in Nigeria. So Yorubas, I mean, I can speak certainly of the Yoruba culture where there's that idea that the first bath of the baby needs to be with palm oil, needs to be with very hot water, needs to be with that native sponge. Even though for some grandmothers, they might soak the native sponge for some time before using it. And these days, I gather that, you know, they are trying to be a bit more gentle than they were before. You know, now for the palm oil and the native sponge and the first bath in quotes, it isn't a question of right or wrong. For me, it's a question of, is it necessary? Does it do the things that they say it does? What they say it does is that it actually prevents the baby from smelling both now and later in life. Well, nothing can be further from the truth. Even if you say it prevents baby from smelling now, if baby does not, or the child does not, that becomes an adolescent or a teenager, does not scrub their armpits, does not use deodorant, does not take a bath and take personal hygiene seriously, they will smell. Do you know? So it has nothing to do with how they were bathed and, you know, cared for at birth. The thing about the palm oil is that I generally say that if you can eat it, then you can safely apply it on your skin. So for instance, if you can eat butter, you can eat palm oil, granite oil, you can safely apply it on your skin and it won't harm you, but will it be beneficial is the question. And I mean, there is no evidence that there's any real benefit that applying palm oil to the skin, you know, gives. Especially if you apply it just the once and then that's it, you know. So I mean, so that's it. So it's not going to harm you, you know, but will it stop the baby from smelling? That is what you know, one is not entirely convinced of. That's one. Two is that the water that they use to bathe these babies is usually too hot. I find out that that water is hot. They press the body of the skin, you know, of the baby, and that too is unnecessary. The baby doesn't need more than water that is like lukewarm, you know, so around body temperature, and that is all the baby needs. So should you go up in arms against your mother or mother-in-law because she's using the palm oil? No, you know, there is no need for you to go up in arms because it isn't dangerous. However, the iron, the wooden sponge, they just want them to be as gentle as possible. Any bath that the baby will take that will make the baby begin to shout, that is not bath. That one is a tribulation.
Right. Tribulation. Oh my God. And you know, speaking about bath, right? How, you know, because people take the children's bath in the morning and at night. While some people say that it should be done just once a day. What do you have to say about the amount of times that people bathe children in a day?
So I saw a very interesting comment here from Sandra Remy. It's very hot. So very hot water washes off the natural oils in the baby's body, and I agree. So the problem with you know, bathing twice a day is that the soap and even the hot water actually gets rid of the natural oils and the natural protective barriers on the baby's skin, and so the baby will come down with a lot of skin irritation and rashes. All that is required is that the baby is actually bathed once a day. And in the evening, all they need is just a clean washcloth or face towel, and then you rub the really soiled parts of the body, you know, like the groin, the bum area, under the armpits, and then just wipe the face. And that is all that is needed. As a matter of fact, the American Academy of Pediatrics, and people will roll up and say, no, American should not come and tell us what to do. They said that you actually bathe the child only like thrice a day. The remaining times, you should actually thrice a week. Thrice a week. The remaining times, you should actually just do like what's it called? Wash towel. Get the towel. You know, nice clean towel. Rub the skin rub the back, rub the bum bum twice a day, and you're good to go. But getting basia and sitting down with soap and water, sitting the baby down inside the bathtub should happen only 3 times a week. But in Nigeria, I know that, our environment is hot, our environment can be a bit, one kind. So you can do it every day, but please limit it to once a day. And that is okay. The twice a day is too much for baby's delicate skin.
Wow. Wow, this is amazing. This one 3 times, because I think abroad, I think you're correct, because abroad you hear that they don't bathe their children, their babies every time. Right, but yeah, you even bathe the child like if you baby should poop like this, just use that opportunity to bathe the child. Another one.
No.
Amazing.
Once a day is fine. Once a day is quite fine.
Wow, now up to 5 times they bath here, my sister. I'm telling you, now up to 5 times. Oh God, help us with these children. Okay,
up to 5.
And then you were saying something about heat and all that. So speaking of heat, right? Because children, when they are born, we always like to wrap them up so much. You wear inner, you wear on top, you wear a lot of things, and
yes,
but at the same time they're still having a cold, because they will say if you expose the child will still have a cold. I'm just confused about this wrapping that we wrap so much, even when the weather is like and baby is sweating. And children will still always have a cold. What can you just address the two of them separately or together?
It's a very difficult thing. So when we say, oh, the child has a cold, most people just mean to say that, oh, the child seems to have a stuffy nose. Okay. So number one, a stuffy nose, yes, a stuffy nose is part of life and it's part of living. So once you accept that a child will have a stuffy nose, whether you overwrap them or whether you expose them, then you come to a little place of some kind of peace. I know that for a lot of mothers, a lot of parents, the sound of a stuffy nose is very distressing. They just don't want to hear that the child is doing any kind of sniffing. But most stuffy noses come and go by themselves without events. As long as the child is eating well and the stuffy nose isn't there all the time. It's just that, of course, parents don't want to even hear the stuffy nose at all. But for most of these children, if you look at it carefully, you find out that they have a stuffy nose only at very specific times of the day or only after very specific activities. So, for instance, you can actually hear that the stuffy nose is there maybe during feeding or shortly after the bath time, those sorts of things. But when the baby is sleeping, you won't hear any kind of stuffiness of the nose. That is not the kind of nasal stuffiness that you should be worried about. However, if you are seeing that for the baby, there is catarrh coming out of the nostril, they are refusing to feed because of the stuffiness of the nose, there is a fever, or another sibling, an older sibling, is also having stuffy nose and came to kiss the baby, then that's the stuffy nose that you can say, oh, I'm concerned about because baby is not feeding well. That being said, when it comes to overwrapping or wrapping baby, or how much clothing you should put on baby, if you are feeling hot in an environment, believe you me, that baby too is most likely going to be feeling hot. So use yourself as a sort of gauge. If you are sweating in that room, then your baby is definitely going to be as uncomfortable as you are. So it means that if you find out that you are sweating, check on your baby. Your baby might be sweating as well. Even if they are not clearly sweating on their face, once you actually take off the clothes, you can find out that they might actually be sweating inside. And the problem with a baby that sweats when they are overwrapped is that that sweat is liquid, and once they sweat into their clothes, those cold clothes remain on their bodies and make them cold. So the heat that you think that you are trying to escape from, because they have sweated into their clothes and those cold clothes are in contact with their skin, then they become cold because that cold. So the last thing that we want is that babies should sweat. So if a baby is sweating, it means that they are too hot, and then you need to now expose them. And this applies to babies right from the time that they come back home from the hospital up till 1 year thereabouts. Okay, so of course we have inner wear, outer wear, all those things. So you have to use your discretion and decide that, okay, this environment is quite hot. Let me just reduce all that the baby is wearing to maybe only the outer wear. Let me just skip the inner wear. So just the Pampers and then the outer wear. the idea of gloves, in Nigeria is not something that I think we should be pursuing too actively. Gloves for what? They don't really need gloves. And then when they are sleeping, they don't really need cap. I know that when, babies are going out, we must always wear cap for them just to protect their head. Well, no problem. I have no issues with that. But once you get home, please, there is no need for the cap unless you feel that the baby is particularly cold, which is why it's important for us to get a thermometer at home. So please get your thermometer. And then if you measure the temperature, because you feel that baby is sneezing or anything, and the temperature is less than 36.5, then you can put a little bit of extra layer of clothing. But if not, I think babies should just be comfortable with the outer wear only in most circumstances. However, when it comes to the issue of AC, and I must mention this, please, babies should enjoy air conditioning. There's no reason for you to not put on air conditioning for babies, especially if you put air conditioning somewhere between 20 degrees and 25 degrees. And then in that situation, you can actually wear the outer wear and the inner wear. And even the cap is not, necessary, especially if the baby is going to sleep. Babies should actually not sleep in caps because they can actually use those caps to cover their faces, okay? So between 20 and 25 degrees, outer wear and inner wear, and you are good to go.
As we're speaking, someone said that babies don't get hot. I mean, babies don't feel heat. I don't know. Wow.
They do. I've seen it. They do. They even start to shout. There's some babies like this that, they will be shouting uncomfortable. But the moment you turn on the AC, so for instance, they are waiting in the waiting room in my consulting room, and then the waiting place is rather hot. But as soon as they enter into the consulting room with the AC, come and see peace and calm, the way they just calm down and begin to sleep. So babies feel heat, please.
You would rather that babies are kept in air conditioning, AC, than under the fan?
Yes, and that's because unfortunately fans, especially standing fans, they don't really deliver a uniform kind of cooling. So because fans keep on, moving from side to side, how the coolness of the air circulates is not uniform. So ACs give a more uniform circulation of coolness, such that everywhere is the same temperature at the same time. Then standing fans and ceiling fans, they kick up a lot of dust. So and you might think that, oh, okay, at least, but the standing fan doesn't look so dirty. But believe you me, all it takes is just a little dust to accumulate on the fan for it to get into baby's nose, and then the baby begins to sneeze. Okay, so some of this sneezing that babies do might be a little bit of dust from the fan, and these fans, they kick up a lot of dust. So even if there's no fan on the dust in the environment, these fans are just busy blowing it up and down, blowing it left and right. You might not even feel it, but the babies that are just coming out, might actually. So normal room temperature should be between 22. So yes, so set that exactly. So set the AC between 22 and 25 degrees. Some people say between 20 and 25 degrees. Yeah. So that is, so for standing fans and ceiling fans, they don't deliver a coolness that is as uniform as that of the AC, and they kick up quite a lot of dust.
Amazing. Thank you, sir. But so still on the cough and catarrh, because I know that once a child starts to sneeze, we can go and buy cough mixture. And what do you have to say about using cough mixture for children? Because sometimes I even realize that when we take our child to the hospital, doctors are very reluctant to give cough mixtures. But if they will not give it, just to buy it, right? Everybody mix their house, even for toddlers, for those above 1. Please, what do you think about cough mixtures?
So cough mixtures, of course, are a very common drug that we give babies who are coughing because they are easy to access, they are over the counter, and quite frankly, some manufacturers of these cough mixtures actually make them for children as young as 3 months, okay? But where some physicians, especially pediatricians, are a little bit cautious about giving cough mixtures is that sometimes some cough mixtures, especially those that contain medications that can make babies drowsy, actually have some side effects, okay? And these side effects in some instances have actually been fatal for some children. And so the recommendation is that for children below 2 years, please don't buy any over-the-counter cough medication unless you have actually had a discussion with your physician as to if that is something that you can give them. That's one. Two is that a lot of these cough mixtures actually don't suppress the cough. They don't do anything for the cough. You just be giving it, and you are giving it just as a sort of as something. So it's not be like as if you are not doing anything for the child. But if you actually closely ask a lot of mothers who use cough mixtures, you find out that these cough mixtures, a lot of them don't actually do the work. And for those that actually work better, they are the ones that unfortunately you cannot give to that age group that is less than 2 years, because some of those more potent components of the drug cannot be given to those children less than that age, because the last thing that we want is a drowsy baby. The only way in which some babies can communicate is by crying, is by, you know, alerting us that something is wrong by crying. But if a baby is drowsy, then they are not going to be able to actually alert you that there's something going on. And so we don't want a drowsy baby. And so that's why we always say, you know what, avoid cough mixtures in a child that is less than 2 years, unless you've spoken with your physician and then they actually give you a cough mixture that is actually designed for children of that age. I saw a question about Muslims and babies. So yes, lots of Muslims that shave babies, is there need to use cap or not to sleep in the AC? Still, there's no need for the cap. There is no need for the cap. We should never actually allow babies to sleep with the cap on, because it's a suffocation hazard. So shaved hair or no shaved hair, please. Once the body is well covered, then there's no need for the cap. Yeah.
And is nasal spray okay for those for children below 5 weeks, something like that?
Yes. So yeah, saline nasal drop, saline nasal spray, they're actually fine. It helps to actually loosen up the mucus, especially if the mucus is not coming out. So you can actually use saline nasal spray or saline nasal drops, even if the child is less than 5 weeks. Again, you know, if this is some kind of nasal obstruction or some kind of nasal stuffiness that is there and then goes and then comes, if it's not disturbing the feeding, if it's not there all the time, then you might not even really have to do anything. But if you feel that it's particularly disturbing for the child, so that as they are feeding, they seem uncomfortable, then yes, use the saline nasal spray and it should give you some kind of help. Yeah.
Yeah. Somebody also asked a question. I was going to ask you, but let me just ask. So he said that rearing. So when you talk of children, right, especially for babies, you know that thing that will block so that the child. Some children are not just eating. I don't know. Let me talk about that too. So what do you think about for children so that the child will have something in their stomach?
Force feeding is never a good idea. It's never a good idea, because of course, you know, without overflogging the issue, children have died in the process of being force fed, or even if they didn't die in the process, they actually died because of the complications of being force fed. Because the food, sometimes you can imagine that you know, they will just you know, block the nose of the children and then block their mouth as well. So when they try to, you know, inhale, you know, or, you know, open their mouth to take a breath, then you just quickly force the food down. And in opening their mouth at that point in time, they're not trying to open their mouth to swallow. They're trying to open their mouth to take a breath. And so the food, rather than going in through the gullet, to the esophagus, is going in through the airway, you know. So they are breathing in the food. And if food has ever gone to the wrong way for you as an adult, you know how you know how terrifying it feels. And so you can imagine that a whole cup of pap trying to go into the airway, and of course that gets into the lungs, and that causes some very serious pneumonia, you know, that sometimes even requires that the child be placed, you know, on a ventilator. And so that's the last thing you want, because at the end of the day, I understand that, you know, some people just want babies to just have something in their stomach. Well, it's better to have a hungry child than to have a child that is no longer with us. So what I'd say is that never make feeding a difficult time, because the child will carry that anxiety about meal times into adulthood, into, you know, later into childhood, and will have a very bad relationship with food and with feeding times. And so it really just has to do with encouragement and trying to find the right thing to give your child. Yeah.
Amazing. Wow. So because I know some children, they just don't like it. Any sport they want to vomit. That about vomiting, you just be like, and I think I'm really frustrating for parents, because you have done everything, you have gone through everything, and then eating, and then you just want to keep throwing up. I mean, I don't know, but so your advice is that just keep trying.
Keep trying. And again, if you feel that you are getting a little bit frustrated, I mean, discuss with a nutritionist. Don't feel like you need to go it alone. Discuss with other mothers and see what has worked for them. If you think about all the variety of food that we have in this part of the world, rich, nutritious food, you really can't exhaust everything and all the options. And the fact that you're giving them one type of food to try once and they've refused, it doesn't mean that they might not accept it later if you persist. So keep trying the same things that you tried before, and then look for also a variety of things to offer them. But of course, one thing at a time, so that if they react to anything, you can know exactly what it was that you started when they developed a reaction, whether it's a skin rash, whether it's coughing, whether it's some diarrhea, whatever it is. But in nutrition, discuss with a nutritionist as well. They have brilliant ideas. They can give you a meal plan, and don't try and go it alone, so that can get very frustrating.
Good. And then I think another thing I've noticed about I know it's very important to exclusively breastfeed your children, right? But exclusively breastfed children, after 6 months, they don't want to move to semi-solids. They still want that them maybe normal milk, you're giving them pap and all that. You're trying to. So how do you deal with migrating for a woman who has done the to semi-solids?
So this isn't also entirely. I know that this is the experience of some mothers, but I believe this is the experience of the minority of mothers. For a majority of mothers, even if they exclusively breastfed their infants, when you begin to try to introduce semi-solids at 6 months, the transition is very smooth. It's for a minority of children who are exclusively breastfed that the transition is difficult. But because, they were exclusively breastfed, then it becomes like, no, it's because of this exclusive breastfeeding. There are some babies who they had that what they took majorly was formula. And by the time they get to 6 months, it's still difficult to actually make that transition. But nobody talks about those babies because they seem to just who continue with the formula that you were on before. But there are also babies who were formula fed who also find that transition a little bit difficult. But that being said, when it comes to babies who are exclusively breastfed and now start refusing formula, start refusing semi-solid foods, I always say, look, if they're refusing all those things, do they sometimes show interest in the food that you are eating? And a lot of the mothers say, yes, actually, they are actually showing interest in the food that I'm eating. They want to actually eat the food that I'm eating, but they'll just take a few spoons or just take 1 or 2 spoons, and then they run away and they're not interested. And I say, you know what? Give them that 1 or 2 spoons. Give them that little. It's a sort of way of trying to gradually coax them in the direction of starting semi-solids. Sometimes it's a problem of, texture. It's not every child who, is a huge fan of puree. It's not every child who is a huge fan of blended food. Sometimes you want to even try to start them off with food that is mashed, okay? Food that is mashed but is very soft, not all the way to blended. So try a variety of textures, and don't assume that, because, they are babies, they wouldn't like things that are sour. Don't be afraid to try to introduce them to things that have a bit of a sour taste, whether it's pap, whether it's baby's character. Exactly. So the baby's character, the baby is just resistant to change. So try to introduce them to things that are even sour, like pap without sugar, and just maybe just a little breast milk in it. So things like that. So what I'd say is that don't put it down to your exclusive breastfeeding as the reason why they are, having the difficulty in making the transition. It really has more to do with the temperament of the child than anything else. And you can't give up. Keep trying.
Okay. So, okay, there's a question. Let me just take this one. I know that my baby weighs 0.7 kg or weighed at 2 months, but when we went for immunization at 3 months, the weight dropped to 6.5. Why a child will lose some weight?
Seems to have lost some weight. Well, I don't know if it's the same weighing scale. There's so many factors there. Whether it was the same weighing scale, whether the battery of the weighing scale was okay, if it was an electronic weighing scale. what the child was wearing, you know, at that 6.7, was it with Pampers, was it with diapers? At this 6.5, was it with diapers, was it without diapers? Was it at the same hospital? So there are a lot of things that are surrounding this. We're never happy when a child loses weight, even though 200 grams might not seem like much, but in a 1 month period, that's not the best thing. Except maybe was ill, you know, and you know wasn't eating for some time, then that could explain the weight loss. But generally, if that wasn't the case, then I'd say that let's look at trying to get the weight done consistently in the same manner, such that the child is completely naked, no diapers, no clothes, so that we are getting the same and accurate result all the time. Yeah.
Thank you. All right, I know that a lot of people are just joining. So for those who are just joining, welcome to this lovely. We've been having such a great time with Dr. Reina, like so many questions, and I'm not halfway through, but we'll still have to leave when it's time, right? So we do this every month. We bring in people, experts, to come and talk to us about different things, right? And this month we are talking specifically about pregnancy, about new around it, what to debunk, what you can continue, and all that. So if you're not following Dr. Reina or myself, you are wrong. So first off, Dr. Reina is someone that deals with children, and in a very interesting way. First, you have to follow him. I would always invite people here to talk to us about different life transforming topics. So if you're not following any of the both of us, click the follow button. It is very, very important to follow us. Okay, so my next question now, sir, is this. When it comes to why is it that, what are the things that happen in pregnancy that leads to having children with maybe jaundice, all those things that happen to children? What are the predisposing factors? Because I know that that's one of the fear that pregnant women have. You know, the child has jaundice and all that. I know that a lot of pregnant women, they are pregnant, maybe they had high BP, whatever. What's the connection with all these things and then having?
Okay, and well, unfortunately, there isn't any specific condition in mothers that can make the child have jaundice. However, there are some naturally occurring things, you know, in the mother that can predispose the child to developing jaundice. So, for instance, the mother's blood group. If the mother's blood group is O, so if the mother's blood group is O and the baby is either A or B, then the baby can have really, really severe jaundice. Or if the mother is rhesus negative. So, for instance, mothers who are maybe O negative or A negative, and then the baby is maybe B positive. So that rhesus factor is that negative. If the mother is rhesus negative and the baby is rhesus positive, then the baby can also have really, really severe jaundice. So which is why if a mother is O positive and then the husband is either A or B, we always, you know, we're always on alert to say, okay,
sorry about that.
So we always say that, okay, please, let's make sure that this baby doesn't develop, or let's watch out for jaundice, because unfortunately there's no way you can prevent the jaundice from happening, but you can detect it early by checking to see if the child has jaundice early, especially if previous pregnancy. So for instance, if a mother gives birth and then we take a history and we find out that, this mother is O positive, this baby is B positive or A positive, and then there is a history of severe jaundice in a previous baby, then for that baby, we begin to look out for jaundice very early, so that if we need to start phototherapy, we start phototherapy on time. If we need to do exchange blood transfusion, we do exchange blood transfusion on time. Some people used to say that, if a mother has malaria in pregnancy, that it can give the baby jaundice, but that also has not been proven. If the baby itself does not have malaria, then it's not really likely that the baby will get jaundice because the mother has jaundice. However, there are some cases where the baby can actually catch malaria from the mother. They call that one congenital malaria, which means that the baby caught the malaria while still in the womb. But even that has not really been proven to actually cause jaundice. So what I say is that mothers, if you are O positive and your husband is A or B or even AB, and or if you are rhesus negative and your husband is rhesus positive, then your baby is at risk of developing very high levels of jaundice. Yeah.
Wow, amazing. Wow. Okay, this is the first time I'm even hearing this.
Yes,
so I think that it's something, just be praying that your child like this. Not something, I mean, this is very enlightening now, because I didn't even think.
Yes. Blood group.
are there habits that pregnant women do that also that can also affect a child negatively when born? Like things that people should be careful about when they are pregnant?
Yes. Yes, they are, and I think thank you, Fair. That's a very important question because when it comes to things like consumption of alcohol, I know that of course a lot of mothers know that once they get pregnant, that is the end of alcohol consumption in any quantity because a child, a newborn or a baby can develop what we call fetal alcohol syndrome, in which there can be some issues with the heart, there can be some issues with the appearance of the child. And with fetal alcohol syndrome, we don't know the exact amount of alcohol that can actually cause fetal alcohol syndrome. So in pregnant women, we just say, please avoid alcohol by all means, meaning that you must be very careful about what you consume when you are pregnant. The other thing, of course, is smoking. So smoking in pregnancy is also something that we discourage very strongly. And this is not only if the mother is smoking. The mother actually should not even be in an environment where they are smoking. So lounges, bars, smoking by a partner in the house, that should not be done because it can predispose the child to developing even sudden infant death syndrome, even when the child arrives. So we want to discourage mothers from smoking in pregnancy at all. Then certain habits that are coming up now. I don't believe that there's any. I mean, there are some people that they still want to maintain a slim figure even in pregnancy. So slimming teas, please. We don't know what these slimming teas contain. So one would strongly advise that one stays away from herbal preparations, slimming teas, because as one of my professors said, as the woman is slimming, the baby too is slimming, and the last thing that we want is a slimmed down baby, because a baby that is slimmed down is all the organs will be tiny, the kidneys will be tinier than they should be, and that can predispose to hypertension even later in life. So the child is 50 years old and is wondering why he developed hypertension, so early. It's something that the mother did even when, she was pregnant. She was pregnant with that particular adult. So, of course, the idea, food as well. One must be very careful about food, in pregnancy. So you can't have, all this funny raw fish, or undercooked meat or undercooked pork, all these funny exotic. Pregnancy is not the time to be trying exotic dishes that maybe the only way that they've cooked the meat with lime juice and they say, it's carpaccio, it's capa, what? No. So avoid that by all means. Then of course, drugs. Please, I cannot overemphasize it. In pregnancy, you need to be discussing with your physician and your gynecologist before taking any kind of drug. Okay, can 3-in-1 Nescafe be taken during pregnancy because of the caffeine? 3-in-1 Nescafe caffeine. I'm not sure that the caffeine in that 3-in-1 Nescafe is so much. It's not coffee. It's not black, strong coffee. So what I'd say is that, for 3-in-1 Nescafe, I believe that it's actually safe, but please discuss with your gynecologist and he'll give you a full blown. For 3-in-1 Nescafe, there's no caffeine in that one now.
Awesome. So thank you, sir. Because just very, very important that we know these things. Then, okay, so let me quickly talk about male children, right? This thing that happens with male children. I don't even know the English of it now, but I know it's Yoruba. Inuwo, sorry. I know they call it Inuwo. That thing that happens there when their tummy just keeps aching them over and over when they are very, very young. What is the cause of that? And there's this nospamin, that's a very common thing that they would always ask that you give them. But some people will still say that it's not good to give children nospamin, that thing is a natural stuff. Some people would even say, there's an agbo for it. I think I'm going to ask like a 2-1 question, right? So giving children agbo, babies agbo, some people bathe children with agbo to avoid rashes or to cure rashes, and then they now give them, when I mean children, I mean like a month old, 2 months, and all that, to drink, yes. And then I'm sorry, what's the English for Inu also? I don't know. But
it's colic.
Colic, yes, exactly, colic, yeah. So how do you deal with boys that have colic and then giving all these things? Like, no, families don't even really want that. There are other things that they give them. So can you just help us address that?
Yes, so colic is a disease that we classify as functional gastrointestinal disorders. This just means that there is really nothing wrong with the child's intestine. The child's intestine is fine, but it's just giving the child problems for certain reasons that we are not sure of. And in this situation, we believe that colic can cause the child to cry for more than 3 hours in a day, for more than 3 days in a week, and 3 weeks. And colic can last for up to 2 months. Some children can actually have colic till 6 months. It can be very distressing for the parents because the child is crying, nothing seems to be comforting the child, and then it happens usually towards the evenings when everybody is already cuckoo stressed out already. And this can happen for a long time, and the crying is relentless. Nospamin comes into the situation because nospamin is sort of like a drug that helps to relieve that helps to reduce the movement of the intestine. So the problem we have with the nospamin is that sometimes if the child is not crying because colic just suggests that it's from the intestine, but it's not always so. Sometimes it can just be some unspecified discomfort. So a child whose intestine is moving normally, and then next thing you now give nospamin, the nospamin can actually stop the natural movement of that intestine, and then the intestine will now stop functioning properly. And so all the breast milk that you are giving, all the food that you are giving is not going to flow through the way it should flow through because nospamin has stopped that natural movement. And what happens, like a pipe that is blocked, all the food begins to back up, and then the child can actually start vomiting, and it can resemble intestinal obstruction. And some children have almost gone into theater. I've almost gone into operation. This child was 2 weeks old, almost went into theater operation room because of nospamin. It's just that somebody now said that, this one is giving nospamin now. And once the effect of the nospamin wore off, then the child didn't need to go into theater again, and the child became well. So please, no nospamin. Gripe water doesn't really work. Some people believe that, gripe water actually helps. Well, it's a placebo effect. For some babies, it seems to work. For some babies, it doesn't. But at best, it's ineffective for most babies with colic. The pressing of the navel with hot water, with hot lantern, that also is not something that works. Even all this our white noise and then tummy massage, it works for some people, it doesn't work for some people. At the end of the day, most gastrointestinal experts will say that when it comes to colic, the most important thing is actually reassuring the parents that this is something that you will manage and that will go away by itself eventually. So just try and endure, try and cope. I know, as terrible as that sounds, it's better than giving a child a drug that has side effects. The general rule for us is that if we can actually treat a condition without giving any kind of drugs, then we'd rather not give drugs than give drugs, because drugs can be hazardous. Drugs are not free of side effects. Not even paracetamol is free of side effects. So that is the direction in which we really want medical practice to be going. That if we can treat without giving drugs, then that is what we should actually be doing. That being said, it's not only common in boys. Colic actually affects both boys and girls in equal proportion. So let's all manage colic.
Manage colic, amazing. Hey God, I beg you. I mean, I can, as you're talking, I was just remembering. I mean, I'm also guilty of nospamin. Sadly, I wish I had this conversation earlier. We gave nospamin that time, but you're very correct, because I mean, I didn't really see any remarkable difference there and all that stuff. So I think you're 100% correct. Then the agbo part, even apart from for colic, what do you want to say about giving children agbo?
So the agbo is always the agbo is sorry, is it advisable? So the agbo is definitely not recommended. It's not required. It is not encouraged, actually, because while a lot of babies might have received agbo and nothing happened to them, there are some babies that you just don't know the peculiarities of their own system and how they will react to the agbo. I had a situation where there was this child that was giving birth to in America, came back to Nigeria. The mother came from the village, grandmother came from the village with agbo, healthy, happy, good-looking baby, and then they gave the child this agbo, and the child developed liver failure. So the liver just shut down, and the child eventually died. And this child was about 2 months old. And unfortunately, I mean, and this was agbo that she had given to some of the other children, and nothing happened to them. So while the agbo might be harmless to some babies, it might severely harm some others. So the advice is always just stay away from it, because you don't know what they are putting in those things. They might tell you that, oh, it's this leaf and it's that leaf and it's this herb and it's that herb, but in what proportion? What are the side effects? They'll never tell you that agbos have any kind of side effects. And the fact that something is natural does not mean that it is without side effects. Anything that you are taking into your body, even if it is natural in quotes, it can harm. It can be harmful. So, I think so. Sandra Remy said, to be very honest, agbo is harmful. That is how we should state it. But at the end of the day, they will still come with evidence and they'll tell you that, but we gave it to this, and these children, and nothing happened to them, you know. But and that is the evidence that they're presenting to you, to let you know that, but we gave it to this child and nothing happened to them. So at that point, your argument has to be that, okay, but have you heard of the ones that something happened to? And they will never say that they've heard. They'll say, no, agbo. But at the end of the day, yes, agbo can be severely harmful. At best, it is absolutely unnecessary, but at worst, it really can be harmful. So yes, I agree. Agbo is, not recommended at all. It can be harmful, and I would like to say that it is harmful. But the argument that they'll bring to you is that, we're giving Shebi, your husband self that you are shouting about. We gave him agbo, and she still, yeah, Shebi, you still married him.
Awesome. Okay, so there's a question here. I have a 3 weeks old. I'm sorry, guys, if I can't ask all your questions. There are a lot of questions and we don't have so much time. So sorry. Please, I have a 3 weeks old that eats so well that breast milk is hardly enough for her. I use Aptamil 1. Is this fine?
Sorry, say that again.
So she said that she has a 3 weeks old, but breast milk never satisfies, and now she has introduced Aptamil 1. Is that okay? Okay.
Yes. That's totally fine. Even though, I wonder why you feel that the breast milk is not satisfying. It's not satisfying them. I think maybe the child has a very large appetite, and you keeping up with all that demand is very stressful for you. But how many breast milk does the child really want to finish eating? So so the demand is really high, and I think that's what's going on. But the breast milk will satisfy him eventually. But yeah, demand is high. But yes, there's nothing wrong really with starting the formula if you feel that you're not keeping up with the supply. But in the meantime, try to see if you can express and store in the freezer so that somebody can feed with a bottle, so that it doesn't overwhelm you too much. But as long as it's still predominantly breast milk, then you're good to go.
So speaking of breast milk, why is it that some women are unable to produce milk?
So this problem with either delayed or the lack of capacity, or rather not lack of capacity, but the fact that a mother does not lactate, yes, it's something that can happen, and that can happen for a lot of reasons. So psychological stress, dehydration, illnesses, certain types of drugs that they are giving the mother. All these things can play a role in not allowing a mother to lactate. And once everything has been tried and the mother actually is still unable to lactate, then of course we have to introduce formula. As a matter of fact, in the abroad, if you give birth and they just see that your breast is doing messy, they will just start formula for the child, but they will still be coming back to the mother to see if they can get colostrum. If they can get colostrum from the child. One of the things that actually helps the mother to actually establish lactation very early on after delivery is if the child is actually put to the breast within the first hour of life. So we always try to advocate and encourage that as soon as baby is born, if the mother is willing and able and the baby is well enough, place the baby immediately on the mother's chest and allow the baby to actually nurse within the first hour of life. Because certain hormones in the mother's body, like prolactin and oxytocin, are very high in her body, and the baby is very alert, such that at that point in time, the baby is able to actually latch onto the breast, and then the milk let down reflex is actually very high at that point. But once you lose that first hour, the baby becomes sleepy, the mother becomes tired, and then you lose that opportunity, because after that first hour, the baby is in and out of sleep up to 16 hours a day, and so the sucking is not going to be as vigorous, and the stimulation is not going to be as intense as we would like it to be. So yeah, if the mother is not lactating for any reason, well, we have to do formula. As to why that happens, it has a bunch of different reasons, which will have to be discovered individually for each mother.
Okay, so somebody was taking it back to jaundice and said that if both parents are O positive, is there anything for jaundice?
Sorry?
Can it impact? Can it?
Yes, yes. So yes, a child can still have jaundice even if both parents are O positive. But in that situation, it won't have anything to do with the blood group. It will have something to do with other types of issues with the baby. So for instance, there's a condition that we call G6PD deficiency. It's one enzyme that is on the red blood cell. And so when that enzyme is deficient, it can actually cause the child to develop jaundice. There are also certain types of conditions that the baby can develop, like an infection in the newborn period. A bacterial infection in the newborn period can actually also cause jaundice. Certain drugs too, can cause jaundice. So, so based on the blood group itself, if both parents are O positive, the baby cannot develop jaundice from blood group problem. But they can develop jaundice as a result of things like G6PD deficiency, use of mentholatum, if that child is exposed, to mentholatum, infection. So there are various other things. But from blood group, both parents are O positive. If that child has jaundice, there'll be blood group issue cause that.
Right. So I think I'm just going to wrap with this because I know that time is far gone. So care of these, a 2-in-1 question. I saw this, somebody dropped this talking about using mentholatum for children. There's this other one that they used to use, they used to spray around children that have a cold. I can't believe I've forgotten it all of a sudden. Oh shoot, I forgot it. But
camphor?
No, not camphor. When children have a cold, they just spray all around them. It's like
eucalyptus oil.
Exactly, right? So how healthy are those things? And then finally, care of the umbilical cord. What's the best way to care for it?
Okay. So,
and what's the best way for a child that has been circumcised, a male children that have been circumcised?
Okay. So, for eucalyptus oil and mentholatum, for children who have G6PD deficiency, those things can actually cause severe jaundice in them. So we always say avoid eating such babies. But the problem is that unfortunately we don't know which babies have G6PD deficiency and we don't know which ones don't have G6PD deficiency. In some countries of the world, as soon as a child is born, they actually screen the children for G6PD deficiency within the first week of life. But we have not adopted the universal screening for G6PD deficiency. And why they do that in some countries is that it can really cause very severe jaundice in the newborn period. So what we say is that, please, for these children, there is really no work that the mentholatum is doing. The mentholatum is not making the child warmer. The mentholatum is not really helping the child to, feel better in any way. So please, don't use the mentholatum, don't use the eucalyptus oil for the stuffy nose. And these things really should not be used for any children until they are at least 2 years. When they are 2 years and above, if you think that you want to decongest the nose with the mentholatum, no problem. You can anoint the child with mentholatum. There is no issue. Or eucalyptus oil. But for a child who is less than 2 years, especially not a newborn, please, no mentholatum, no eucalyptus oil for them. So, care of the umbilical cord. The care of the umbilical cord usually depends on where you are. For those that are people that are in their abroad, you know that what they say is that just keep that umbilical cord as dry as possible. They don't ask you, they do not even ask you to apply anything on it. However, what WHO has recommended for us is that we actually use chlorhexidine gel. Now, this is a gel that you apply once a day, and you also have to keep the cord dry for the cord to remain, nice and dry. Methylated spirits too is also not a problem. You actually apply methylated spirits to the base of the cord and clean the whole cord with methylated spirits at every diaper change every day until the cord falls off. Once the cord falls off, please stop applying everything. Stop applying mentholatum, stop applying chlorhexidine gel, stop applying anything once the cord falls off. But I used to joke to some people that I say, so you want to continue applying something to this cord until the child writes common entrance, Abby? So please stop applying stuff to the umbilical cord as soon as the umbilical cord drops. What we've also been told, what they do abroad actually is that you actually don't give the child a bath. When I mean a bath, actually, you don't dip the child inside bath. Yeah, you don't put the child inside a tub of water until the cord has fallen, because you really want the cord to stay as dry as possible until it falls off. Because the wetness, when a cord is wet, it creates an environment that bacteria, love and enjoy, and it's more likely to have the cord infected. So please keep the cord dry, and keep the cord tucked out of the pampers. Don't tuck the cord into the diaper. Circumcision. Circumcision sites for males, usually what they give here in Nigeria is maybe some kind of penicillin cream or gentamicin cream. Please let that be the only thing that you apply to it. Keep the site dry as much as possible. If there is any sort of poo-poo that soils the area, of the circumcision wound or circumcision site, just clean it gently with water and maybe non-scented wipes. So that is all you need to clean it with. And then apply that your gentamicin or penicillin cream or whatever it is that they've given you. Please, no engine oil, no weird things like that, because yes, the people do apply engine oil to the cord. I'm not sure what the purpose is, just to keep it lubricated, but yeah, it's not necessary.
Amazing. Thank you so much, sir. In fact, the question, just forgive me in advance. I have too many questions. Dr. Reina has already said that he has to run. So please.
Unfortunately, these sessions, I really don't know. These sessions, for me, I enjoy them, but they just never are able to answer everybody's questions. And I always feel bad, leaving these sessions, because I'm like, oh gosh, I've not answered this one, I've not answered that one. So many questions I can see here.
Okay, can we just take this last one about water?
Yes.
So the person said that, one person said that her child is 9 months old, until now the child doesn't take water. How can she introduce? And that person said that a formula-fed baby, how is it okay to introduce water? And I know exclusively breastfed babies too. Parents also want to ask that. So water with formula-fed babies, breastfed babies, and then now introducing water after 9 months. So sir, please, let's just do that to wrap it up.
So what we say is that generally, for exclusively breastfed babies, please, no water is necessary. No water whatsoever is necessary until the child actually turns 6 months. Even for formula-fed babies, we also say if you mix the formula the way the manufacturer has said that you should mix the formula, then the child does not require water until the child is actually 6 months. Because when you now start giving water before 6 months, how much water should you actually give? What proportion of water should you give? Even on a hot day or in a day that seems very hot, rather than give extra undiluted water, rather than give ordinary water, please just give extra formula that is well constituted, well mixed. Because in that situation, the child is actually getting more than enough water if the formula is actually well mixed. I think most formulas are 30 mils to 1 scoop. So most formula, but check the instruction. Water is something that some people say, oh, the child is on formula, that the poo will be hard, and so you should give some water. Okay, so if the poo is going to be hard, how much water should you actually give? And nobody can give me the answer to that. How much water would you say you will give that will make the poo now soft? If your baby is on formula and the poo is hard, please consider changing that formula. Have a discussion with your pediatrician, have a discussion with your doctor, because your baby might actually be having what we call cow's milk protein allergy that might be making the poo hard. It's not like as if the child is not getting enough water, but the problem is that the poo is hard for another reason, not that the child is dehydrated, not that the child is getting enough water. How much water will you really give that will make the poo begin to become soft? So please, if the child is having hard poo on formula, have a discussion with your doctor, because the child might actually need to have the formula changed.
Thank you. So, guys, sorry, please, if you have any more questions, some people can reach you. How can I want to reach you? So how can they reach you?
So if they go to my, just let them follow me on Instagram. Unfortunately, my DMs are actually quite full. We have I have my online mothers community, which is called Noisy Moms, and I'm doing this in collaboration with Agnosis Care on Demand. So if they follow me and go to the link in my bio, for 2,000 naira a month, you can actually just subscribe to my WhatsApp channel and drop your question there, and we answer the questions for you right away. So the link for the joining my mothers community is on the bio on my page. So please follow that and join my online moms community.
So guys, thank you. First off, thank you so much, sir. Thank you for being here. Thank you for giving us your time. Thank you for all this wisdom that you have dropped. Like, my God, thank you. So doctor said that his DMs are full. Please just go to the link in his bio, like he has said. Join the WhatsApp group, and then you'll be able to ask him questions, and he will answer all your questions. But if he has to respond to every DM, I don't know if he's free. So please, speaking of DM, go and join the WhatsApp community with 2,000 naira, and then we're going to ask him. You can reach him.
Thank you, Brumambrisu.
Thank you so much, sir. Thank you for
Thanks,
being
everyone.
Here.
Bye. Thanks, Ife.
Thank you for being a part of Ife Talks this month. It has been such an enlightening session. I know that you have received value for your time. This is what we do here. We bring in people to talk to us about different life issues that would help us to make better informed decisions. So if you're not following me, please follow, because this is what we do every time. We keep bringing people to come and share with us, to come and talk to us about different life issues that are very important for you and I. If you're not following Dr. Rena also, please follow him, right? So that you can, because it's always dropping nuggets, it's always dropping things, right? So in Ife Talks, what we do is to bring in experts, bring in professionals every month. Sometimes we do twice a month. Like this month, we're having 2 sessions. I can't wait. I cannot wait for the next session in 2 weeks' time. We're going to talk about something very interesting again, and that's how it keeps going. What we talk about: finance, marriage, relationship, children, abuse, money, purpose. There's nothing we do as long as to add value to you, as long as to help you to make a better informed decision about your life. That's what we do here. So I just go out, scout for people. Some people say, oh, we'd like to have this person. Can you help us with this person? And I try, and by God's help and favor, we bring them, right? So thank you for being a part. Like I said, you should follow Ife Talks. And then, and I look forward to seeing you in the next live. And you should also follow Dr. Rena, because he has done amazing. I know that there are so many questions that we could not answer today, and I'm so sorry. Please, right? I'm hoping that maybe sometime in the future we'll bring Dr. Rena back, right? And then we can have a part 2, because this was so good. Even I couldn't ask him all the questions that I had written down. So I'll see you guys again in 2 weeks by God's grace. Till then, bye everyone. Enjoy the rest of your day, and don't forget to click the follow button. And I would save this. It will be on YouTube, so that you can always watch it. You can send it to any new mom, send it to any pregnant mom, send it to any first-time mom, any friend that you have that you know that would need to listen to what we have shared. Okay, I hope you enjoyed the session. I did too. So thank you all. I'll see you in the next show. Bye for now.